Just last hour, the White House COVID response team saying the CDC still working on guidance for people who have been fully vaccinated, promising that advice is coming soon and that they're focused on getting it right. Meanwhile, new warnings from Team Biden today about the growing temptation, you see many governors doing this, to pull back on mask mandates and for people to pull back on wearing their masks and returning to their pre-pandemic routines now. Dr. Anthony Fauci warning that science and recent history tell us that could be dangerous.
When you have that much of viral activity in a plateau, it almost invariably means that you are at risk for another spike. Many countries in Europe have seen just that. They had a decrease in cases over a 6-week period. They plateaued, and now, over the past week, they saw an increase in cases by 9%, something we desperately want to avoid.
With us to share his expertise and his insights, Dr. Amesh Adalja. He's a senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, grateful to see you. We have been through, you and I have been over the past year, as all Americans have been and people around the world, what Dr. Fauci was just talking about. The case count starts to come down, hits a plateau, people think we've settled in, and okay, I can go back to normal now. When you see, especially states like Texas and Mississippi saying we don't need a mask mandate anymore, is Dr. Fauci right? We're now at a plateau close to 60,000. We were at 40,000 when we had the horrific winter spike. Where are we today?
I think we don't quite know where we are. We have these variants out there that are the wild card, and we've seen cases tick up over the last 7-week average, but the 14-week average is declined. So we have to really sift through that data to see, is this a reporting delay that caused that increase in the 7-week average because of the storms and the weather, or is this a real upswing we're seeing? And I think because of that, because we still have 60, 70,000 cases a day, I think it's too early to say, throw away your masks. I think that these have been shown throughout the pandemic to be able to keep cases to a manageable level. So as governors are looking at their reopening plans, I think they should think about masks as being critical to allowing that reopening to occur in the safest manner possible. Because if you're going to go to 100% capacity for your stores and other venues, you need people wearing masks to do that safely. And even from a business operation standpoint, it's very important to have your customers, your employees wearing masks. And I think that's going to stay for some time until we get more control.
In recent days, we've seen the President of the United States use the word Neanderthal thinking about Texas and Mississippi dropping their mask mandates. Now the White House is in a little back and forth with a Democratic mayor, the mayor of Detroit, saying yesterday that I think the Pfizer and the Moderna vaccines are much better than Johnson & Johnson. So therefore, as long as we have enough Pfizer and Moderna, I don't need Johnson & Johnson. Now the White House says this is a bit of a misunderstanding, and the mayor's now saying that if we have more people in line than we have vaccines, we'll use Johnson & Johnson. But how? Number one, is the Johnson & Johnson vaccine not as good? A lot of people are saying that because of some efficacy data that's been published. And number two, how helpful or hurtful is it if you have this mixed messaging about whether you should get the vaccine if it's either one of the three?
When it comes to what matters, the Johnson & Johnson vaccine is highly effective as the Moderna and Pfizer vaccines. And what I'm talking about there is serious disease, hospitalization, and death. That's what these vaccines are designed to do. And the Johnson & Johnson vaccine is tremendous. A single-dose vaccine. It doesn't have onerous cold storage requirements. And I caution people, when they look at those efficacy numbers for symptomatic disease, you can't just take those numbers and compare them apples to apples. This wasn't one clinical trial that had 3 or 4 different arms with different vaccines. These trials were done at different time periods in different places of the world. So they're not one-to-one comparison. So it's not a valid way to look at these vaccines. And I do think it is harmful, people maligning the Johnson & Johnson vaccine. And I think it does send a mixed message, not only because of the mayor of Detroit, but also the U.S. Conference of Catholic Bishops weighing in. All of that is sort of making the Johnson & Johnson vaccine appear to be not optimal when it actually is. And people should get the first vaccine that they have access to. And the Johnson & Johnson vaccine is a great vaccine, and I recommend it to anybody who has a chance to get it.
Appreciate your saying that. Let me ask you lastly, just your observations on this. This is the NPR Ipsos poll. A question a lot of parents are asking, is it safe to send my child back to school? Going forward, how likely are you to have your child in remote learning indefinitely? 29%, so nearly 3 in 10 parents say, I'm going to keep my child in remote learning indefinitely. That reflects a fear, a safety fear about going back to school. One would imagine there might be some economic impact as well, parents staying at home and the like. But does that number surprise you, and is it safe for kids to go back to school now?
The number surprises me, but I do think that the disruptions that people have seen with schools kind of being at hybrid and the difficulties of switching between the two has influenced parents' choice there. But I do think that schools are something that can be done, can be open safely. We have data from the CDC showing that even when community spread is high, the spread inside schools is very low. There are best practices that we can use. We know to use masks and social distancing, and we know to kind of clamp down on the extracurricular activities where there is more spread. So I think this is something that needs to be the default. Schools should be the first thing to open, the last thing to close. It should be what's open. We have casinos open, we have people going to sporting events, mass gatherings, but we don't have schools open, and it's actually harming children. So I think this is something we need to get right. We need to hold the president to that 100-day promise that he said about schools opening for in-person learning. This is something I think is very critical.
Dr. Adalja, grateful as always. Thank you very much.
Thank you.